Today is a very special episode for me because October is Breast Cancer Awareness Month. As you see my t-shirt, in October, we wear pink. I'm a 7-year breast cancer survivor, and I thought it was really important, and it is important for me to talk about this today because there are so many people who are affected by this disease and will be affected by it in some way, whether it's yourself, someone you love, your mother, an aunt, friends, a coworker. Even some men get breast cancer. I don't know if people knew this, but Matthew Knowles, Beyonce's father, is a breast cancer survivor. And I'm very happy for him and many others. And there are so many others who are fighting through this disease. And so it's really important for us to just have a little chat about breast cancer and a lot of the things that we can do to support those who are going through it and support survivors. I want you to know that, and it's really important because a lot of people have the misconception that breast cancer only affects those who has it in their family. But I was the first one in my family to get breast cancer, and it was caused by estrogen. So please do not fool yourself that it's not possible for it to happen to you. It happened to me, and I never thought I would ever have to say I'm a breast cancer survivor. But I'm happy to say I'm a survivor. But the first thing you should do is just really pay attention to your bodies, please. In 2018, I was diagnosed May of 2018. But in February, I was on a vacation and I was really tired and I was having a good time, but I was really tired. And I didn't feel quite myself, but I thought, we're walking around Las Vegas, and all the excitement. We were going to concerts and things like that. And I thought, maybe that's why I just can't wait to get back to the suite and go to sleep. Well, I found out that I had breast cancer. A few months later, I found that out. So looking back on that, it's like, wow, my body was telling me something. So it's really important. If you are your first point towards the cure. If you feel something is off about your body, even if you don't feel a lump, I felt a little faint, like quick wave through my head sometimes. And I realize now that's what was happening. So please don't brush it off. It could be anything. So just go to your doctor about that. Pay attention to your body. And it also helps if you just eat as healthy as possible and also do self-checks. You know how they say, like, give yourself a hug? But it's really important to just check, if not every day, very often, because that's how a lot of women find out early. They don't even go get regular mammograms, but they find a lump. If you just do self-checks, you can get ahead of the game. You can't always feel a lump because mine was in a really odd place, so I may not have felt it. But what's really important is getting regular mammograms and get the 3D mammogram because that does a full picture. And that's how they found mine. It was like behind the front, area. So it's just important that we pay attention and do those checks and go get mammograms. It's the best selfie you will ever take. And encourage people that you love to go get their mammograms. I have a lot of family members who said, I'm going to go get a mammogram now. I haven't had one in a decade. I almost wanted to yell at them because I'm like, I got my mammogram all the time. I was very regular with them. I had lots of abnormal mammograms, but they checked out to be just like nodules and so forth. But eventually, it was cancer. So it's like, please don't not go because you're afraid of what they're going to say. It's better to hear that you have something and then they can take care of it. Whatever that medical procedure or plan will be, not knowing it's not going to save your life, and most likely just the opposite. If you do find that you have breast cancer, don't panic. of course you're going to have a meltdown. When I got that call, my doctor, he called the day after I had my biopsy. They never called the very next day. So I knew what he was going to say and I braced myself. But when he said, sweetie, it is cancer. And I had such a kind general surgeon, and he hated to tell me that, but he was very straightforward. He said, it's cancer and we are going to take care of you, so don't panic. You're not alone. Even if resources are limited for you, funds and so forth, there are so many outside resources that can help you, get regular mammograms, treatments. People need to be available. If you're watching this and, just do what you can to help people. Donate to different organizations because that helps, get patients rides to their appointments and different things like that. So we just really need to help each other because breast cancer is the most treatable form of cancer. And we've got to stop losing people because they don't have a way to the doctor or because they don't have the resources to go get a mammogram, So let's just do what we can to help them and to help each other out. If you're diagnosed, get a second opinion if you feel you need to. You have a right to do that. I didn't get a second opinion because I had seen this surgeon many, many times, and he was one of the best, and I trusted him. And that's another thing. You have to trust your medical team. If you do not feel like they care or that you can trust them because your life is in their hands, get another doctor. You have a right to get another doctor. This is your body. And so you are in control of your health. You can see whatever doctor you get a recommendation. You can even ask people, who do you recommend? Don't just go with whomever because that's the closest one to my house. Sometimes you have no choice, but please get the best possible for your situation because it's your body and you want to do the best for you. And on that note, do what's best for you and make decisions that are best for you and for your loved ones. Don't listen to the peanut gallery. People always have something to say. Oh, I wouldn't go that route. Oh, that's a lot of surgery. I kind of talked about a lot of this in my book, Cancer Looks Like Me. And the reason I named it that is because people kept saying, you don't look like you have cancer. You don't look sick. But I was very sick. I had breast cancer, a critical illness. And so it kind of irritated me when people said that. And I know they meant well. And they thought they were making me feel better. But then I thought about cancer looks like everybody. Cancer looks like all of us. And so I journaled the entire time through my breast cancer process. And, all of those notes became a book. And so lots of people enjoyed it and it became a bestseller. And that meant the most to me because that meant that people were interested in what I had to say, my experience, and my doctor shared it even with some patients. And he said that it really helped people. And that is why I wrote it, because I wanted to give people some kind of courage because I was really scared. No matter what, it was stage 1. And no matter what, I was very scared because you don't know what's going to happen. I had cancer in my body. So I fought the best I could, and everything worked out for me. But yeah, you do what's best for you. Do not listen to people on the outside and what they would do. Well, it's not you, so it's me, and I'm going to do what's best for me. I got, I chose to do some extensive measures, right? I chose a lot of surgery, and, that was a lot for a lot of people when they were trying to tell me, like, do you have to do that? You have to go that route? Yes, because that's what I want to do. It was the best thing for me. Everybody's different because every body is different. So I did what was best for me and it worked out. Have a positive mindset. And you know, that's so cliche these days, right? But in 2018, when I was diagnosed with cancer and I was going through all of these appointments, it became so tiring. I would have like 2 appointments a week, going to the doctor, going in there, and it's like, I have breast cancer. This is my life now. But I had started, doing things with my nutrition. I kept a positive mindset. And that gave me a boost because it turned me into a fighter. And I am so convinced that that helped me get well. Things didn't elevate the way they could have because I postponed my surgery for a couple months. And I talk about that in my book as to why I did that. But that was a big risk. And I don't suggest people do that because it's very critical that you get that cancer out of your body. But I chose to do that, and I was content with, like, you know what, if things go bad, that's on me. I chose this and I'll take it. But it worked out. And but that positive mindset, when that surgery was over and I went to my follow-up appointments, my surgeon told me that my mind, he said, your positive mindset helped you heal. It helped you fight, because there's so many people that come in, they're like, is my cancer back? Am I sick again? I feel like it's on the other side now. And it's not. But when your mindset is wrong and really low, your body is going to react the way that it's feeling. The fight isn't going to be as strong because you're really down and feeling negative and feeling like you've already lost. You haven't lost, you're fighting. Please fight. If you have breast cancer, do not give up on anything. I have such an awesome family. They were so supportive of me when I got breast cancer. I truly did not fight that disease alone. And they gave me a pink rose ceremony that meant a lot. It was just a few days before I was going into surgery. And so they just were letting me know that I was not fighting alone. And you'll see in a couple of pictures above that, I was just really surrounded in a lot of love. And the more support we give people, the better their fight will be. Breast cancer being so treatable, don't ever miss appointments. Encourage your loved ones. If someone has cancer, please help them get to their appointments. It's very important not to miss your appointments because you are prepping for whatever treatment that your plan has in place. Whatever treatment you have been approved for, whatever you chose, it's really important that you make all of your appointments. Ask questions. Be informed. It's your body. Ask as many questions as you need to. I looked up, everybody's different, but I went to so many medical sites. I didn't go to Reddit or anything else, but I went to medical sites and looked up the type of cancer I had. I wanted to know what was going on. And later on, my fantastic oncologist explained everything to me. But I was informed and I knew what questions to ask because I was informed. So please, you have to fight for yourself. Your health team, you've got to be the top person on your health team and be very proactive in the fight. And when you do that, you would do your best. And that helps you stay positive so that you can survive and move on with your life. Now, the final thing that I really want to stress, and I do not say this to offend anyone who may feel the opposite that I do, but I'm making this video from my perspective. But being the most treatable form of cancer, and breast cancer really is, I beg you, on my hands and knees, please do not choose outlandish forms of treatment, non-medicinal forms of treatment. things that have not been proven by science, because people will go to other countries and try something else, some supplements and things like that. Yeah, that may help the side effects. That's not going to treat the disease. And I personally knew someone who she chose not to go the traditional route. And it is scary. I get that. It's so invasive on your body. I get that. But she went somewhere and she was there for a while and she just got more and more sick and she didn't make it. My doctors begged me, if they tell you to do chemotherapy, please do it. If you have to get on a medicine, like for instance, I was on tamoxifen for 5 years, please take it. Do not stop taking it. It was for my body. And again, this information is about me. I'm not telling you what to do. Okay, I'm sharing my story and what worked for me. And I knew I was going to follow all procedures. I was going to take my medicine, and side effects really sucked sometimes. And they still do. I still have side effects from having breast cancer because of certain medicine that I had to do as aftercare. 5 years is a long time to take medicine, a specific medicine that's like a little form of chemo. I can imagine, really what it was doing to my body. But I did it. I was willing to do it because I had people that I needed to stay on this planet for. I needed to be alive for. And that was my thought process. I'm going to do whatever I need to do to fight to make sure this does not happen to me again. While alternative medicines and so forth, and treatments, people do it, but they're super risky. I don't know, some people swear that they've been healed or whatever, and I can't say that it didn't work for them, but it's so risky and it could cost you your life. So just please do a lot of thinking about that and a lot of praying about it. Because I just don't, sitting here on this platform, I cannot recommend going that route because I've seen how dangerous that can be with any illness. Alternative doesn't always work out in the best outcome. So yeah, you guys, I thank you for sitting here with me, this October, the whole month. Just be attentive to everything. Don't always slide past an advertisement or anything because it's just awareness, and it's important that we're aware. Breast cancer seems to be on the rise, and I don't know why that is. I mean, I guess I do know why it is, but this world that we live in, and we're all so imperfect, but things that we eat are so imperfect, and whatever, even certain medicines can cause problems for us. But yeah, I thank you guys for watching. It really means a lot to me, and it means a lot to breast cancer survivors, breast cancer warriors around the world, family members, their support system. It means a lot. The more people are aware, the more we can be helped. So thank you for watching. And wherever you are in the world, please have a wonderful morning, afternoon, or evening, and take care of yourself and take care of each other. And we'll see you on the next one. Bye.